Prematurity is when a baby is born before 28 weeks of gestational age.
A baby is typically expected to be born at 40 weeks of gestational age, so if a baby is extremely premature, this means they spend a minimum of 3 months less in the womb than a baby born at term. This gives them a lot less time to develop.
Gestational age is defined as the number of weeks since the first day of the last menstrual period of the mother. At 28 weeks, the baby's body isn't prepared to cope with the new environment, so they face many challenges, including challenges to their survival. Babies born earlier weigh less than babies that have more time to develop, and the less a baby weighs, the less likely it is to survive. Due to modern medicine, low birth weight babies have a much higher chance to survive now than ever before.
As you can see from these charts, the average fetus almost triples in weight from 21 weeks to 28 weeks. This makes these weeks critical for survival. If a fetus weighs less than the average, it is even more important for them to have more time to gain some weight. But gestational age for the baby isn't just important because it affects birth weight. As the fetus spends more time developing, their body systems become more ready for the outside world.
When in the womb, all of the body's tissues, organs, and systems grow, develop, and become more sophisticated. When a baby is premature, it is forced to rely on these unfinished body systems for survival.
One of the systems affected is the lungs. So two of the problems that can happen with the lungs are bronchopulmonary dysplasia and hyaline membrane disease, which are both very serious. Occupational therapy can assist with lung development by assisting with positioning to allow proper pulmonary function and decrease the need for supplemental oxygen.
There are also many neurological problems that can occur from developmental issues. Premature infants are often in more pain or uncomfortable, so occupational therapists can educate their family on pain management strategies, and they can have long-term impacts such as lower performance levels in school and poor coordination of fine motor systems.
All right. So prematurity can also affect the cardiovascular system. Some of the problems that are common are PDA not closing, which is a lung formation that should close before birth, but often it doesn't if it's premature. And also they can have high blood pressure. So some ways occupational therapy can help is skin to skin or kangaroo care, where the mother or father holds the baby to their chest. It's beneficial to regulate the blood pressure and heart rate, and also pain regulation. It also promotes breastfeeding and parent-child bonding. Occupational therapists can also facilitate kangaroo care through education by adjusting the environment so the parents feel more comfortable.
There are also gastrointestinal impacts from premature birth. These include necrotizing enterocolitis, which is NEC, and that's a life-threatening bowel disease, and it often requires surgery. There's also GERD, which is gastroesophageal reflux disease, and this can cause frequent spit ups and affect the baby's weight gain. There's also feeding difficulties involved, which an occupational therapist can help with.
Hearing impairments in premature infants are often associated with delayed language development as well as speech-language problems, and they are more common in premature infants than in other infants. Premature birth is the cause of a great variety of serious problems, as you can see. So why do they still happen?
There are many factors that can contribute to prematurity, such as bacterial infections, inflammation, cervical incompetence, and hormonal changes. It's also much more likely to occur when expecting multiples, such as twins or triplets. Physical and mental stress, as well as smoking, have also been linked to cause prematurity.
Many infants who are born extremely premature are taken to the NICU, or neonatal intensive care unit, after birth. Here, the premature infant can receive around-the-clock care from a specialist. Depending on the condition, they can be supplied with all kinds of interventions, including incubator, feeding tube, and many others. The picture displayed is an example of an incubator where your infant is placed so they can maintain their body temperature, which is extremely important for a premature baby.
A premature infant's occupations include feeding, rest and sleep, and occupational therapy can help the baby to achieve success in all of these areas. Some of the ways that occupational therapy can help is by working on oral feeding, appropriate body positioning, modification of the environment to be less stressful for the newborn, and getting the parents involved and comfortable with caring for their fragile baby. Occupational therapists can also work to provide a developmentally appropriate environment for the infant, assess developmental progress, and refer them to early intervention services when needed.